Okay, yeah. Yeah, ready to start?
Okay, good evening everybody. Welcome to North Tyneside Council's Adult Social Care, Health and Wellbeing Subcommittee. My name is Councillor Karen Clark. Could I ask if all members will turn off the microphones and cameras, please, until you're asked to put them on. Just there's a bit of interference I can hear. Thank you, appreciate that. This meeting is being streamed live on the Council's YouTube channel to enable members of the press and public to observe the meeting, and I welcome anyone who is watching. Before we move on to the agenda, I would first like to make it clear who is participating in the meeting. I would like to ask everyone present to confirm their attendance. In order to do this, I shall now call out the names of the members of the committee. After I call your name, please turn on your microphone and camera and introduce yourself. Councillor Trish Brady.
Thank you, Chair. Councillor Brady, Northumberland Ward.
Thank you. Councillor Muriel Green.
Present and correct. Councillor for Wheatslade Ward. Thank you.
Councillor Joe Coe.
To confirm, I'm here, Chair. Councillor Joe Cohen, Monksy North Ward and Deputy Chair of the committee.
Thank you. Councillor Nigel Huscroft.
Yeah, I'm here, present Chair, Councillor Nigel Huscroft, Northumberland Ward.
Thank you. Councillor Tommy Mulvenner.
I'm here, Councillor Tommy Mulvenner, Councillor for Valley Ward.
Thank you. Councillor Kath Davies, sorry, we know isn't here. Councillor Paul Richardson.
Thank you, Chair. Good evening. Paul Richardson, Councillor for Monkston Ward.
Thank you. And we have Councillor John Harrison, substituting for Joanne Cassidy.
Thanks, Chair. Councillor John Harrison, Howden Ward.
Thank you. Can I also ask the officers in attendance to introduce themselves? Scott Woodhouse.
Good evening, Chair. Scott Woodhouse, Strategic Commission Manager for Adults within North Tyneside Council.
Thank you, Scott. Chris Woodcock.
Good evening, Chair. Excuse me, Chris Woodcock, Senior Public Health Manager within the Council.
Thank you, Chris. Joanne Holmes.
Joanne Holmes from Democratic Services.
Thanks, Joanne. Also in attendance, we're pleased to welcome Jeremy Rushmer, Executive Medical Director for Northumbria Healthcare NHS Trust. Welcome, Jeremy.
Hello, I'm here.
Thank you very much. We also have other officers joining the meeting to provide technical support and cover in the event of any connections being lost, which hopefully won't happen. To ensure that the meeting does run smoothly, can I remind participants to please turn off your microphone and camera when you're not speaking. Only speak when you're invited to do so by me, and please activate your microphone and camera before speaking. If any member or officer does wish to speak, please use the hand raise button or the chat facility. Thank you. We shall now begin the formal business as set out on tonight's agenda. Is that a question, Councillor Mulvenner? You have your hand raised, Councillor Mulvenner. No? Yes?
I think you missed out Claire Riley on your list.
Oh, I did. Thank you. Isn't that terrible? Claire Riley, can I ask you? Hello. Apologies, Claire.
You're all right. I'm sure you're all used to me by now. After the many years I've sat around this real table and virtual one. Hi, I'm Claire Riley, Exec Director of Communications and Corporate Affairs for Northumbria Healthcare.
That's lovely. Thanks, Claire. Sorry about that. Okay, item 1. Apologies for absence. Can I hand over to Joanne?
We've got apologies from Councillor Cassidy, Councillor Percy and Councillor Davis.
Substitute members?
Councillor Harrison for Councillor Cassidy.
Thank you. Item 3. Do any committee members have any interest they'd like to declare in relation to items on tonight's agenda?
Yes, Chair. Councillor Harrison.
Okay, Councillor Harrison.
Yeah, I declare that one of my registered interests is I am a public governor for NHS Foundation Trust.
Thank you. Thank you for that, Councillor Harrison. Can we move on to item 4 on the agenda, which is minutes of the last meeting? We're asked to confirm as a correct record the minutes of the meeting held on the 11th of February 2021. Unless any member indicates now, I'll take it that those minutes are confirmed.
Agreed.
Agreed.
Agreed. Thank you, everybody. Item 5, Northumbria Healthcare NHS Foundation Trust Quality Account 2020 to 2021. Can I invite Jeremy Rushmer to present the item? Members will have an opportunity for questions after the presentation. Thanks, Jeremy.
Well, it's a great pleasure to be here again this year after such an interesting time that we've had. I'm just filling in time whilst the presentation loads on my screen, and then I'd appreciate a few thumbs up if you can see it. Can you see my screen? Yeah, and if I move it forward, does it move forward for you as well? Right, I've now got to get it into, let me just make sure I'm full screen. Excuse me for talking you through it, and then I'm going to use for the focus group so I can read it. Okay, so you'll have heard me present this sort of material before. I just want to remind you that this is all part of our 5-year strategy. We're in the middle of that cycle. In fact, we've just held some planning meetings to make sure our 5-year strategy is fit for purpose for the important time of recovering after the third wave of coronavirus. I won't say after coronavirus entirely. Fingers crossed about that, but this is our plan on a page, which is the same one that I showed to you last year, and affirms what we will what is our strategy. And our vision hasn't changed. We still seek to be the leader in providing high quality, safe and caring health and care services, and to lead collectively with partners to deliver system-wide healthcare. And so what we do as part of that process is we produce a quality account, and this presentation is a bit of a look back to last year's quality account. That's 2021. So I'll remind you of what our intentions were, and we look particularly at this meeting at the safety and quality priorities, and then we'll also outline looking forward to our annual plan for 21-20, what we're planning to do, or what we're planning to do next year, and you'll have time to give us some feedback on those. And it's just to remind you that this year is no different from any other year. Improving our quality remains an absolute priority for us, and we want to make sure our patients get the best possible outcomes and experience every time that they need our care. So as I've said before, we're in the middle of a planning cycle that will end in 2023. We will be developing a quality strategy, and I'll be presenting the results of this last year, and in particular giving you feedback on the safety and quality objectives we agreed around this time last year. There will be an annual report that will be made, and we'll make a corporate governance statement, and this is all part of our engagement with key stakeholders. So when we look back at last year, just to remind you that this is a standard requirement for all trusts to report. When we create that quality account, it's quite highly specified by the NHS. And the real thing I would draw to your attention this year is that because of the COVID-19 pandemic, that guidance was altered as an emergency process, and the external audit assurance work on the quality account was not needed to be undertaken. So there is no external audit opinion in the quality account that we'll be giving for this year. And furthermore, there'll be no governor selected. So that's our foundation governors. Local indicator will be chosen for the year, and we'll just be undertaking in line with that change guidance, which was part of the pandemic. So the process is underway. We've already created the draft account, and we're going through that. and that will be available around mid-April 2021. So that's in a few weeks from tomorrow, April Fool's Day tomorrow. It'll be circulated for your opinion at the end of April, and the final version will be submitted to NHS Improvement at the end of May 2021, and that will include all of your stakeholder comments and Health Watch and that sort of thing. And it will be uploaded to NHS Choices by end of June 2021, and we're still waiting for the parliamentary timetable to be confirmed. So this is just a reminder of our safety and quality priorities for the last year. We wanted to look at patient flow and particularly focus on discharge. We wanted to look at the management of acutely unwell patients, or the deteriorating patient as we describe it, particularly around acute kidney injury, the supply and administration of medicines, which I'll explain later on, children and young people's emotional well-being and mental health, especially important as we run the CAMS service for North Tyneside, so your patch, end of life and bereavement with the medical examiners, patient and staff experience. So we had agreed that we would focus on the back door and look particularly at discharge, having focused in previous years on the admission process. And in particular, we wanted to look at our system for medical fitness at discharge in order to try and reduce length of stay to just only that most minimum bit that you need in terms of your medical care, and try and get everyone out as soon as they're well enough to get home, or wherever their home is. Making sure we've got the data to support that. And noting that bed occupancy is now a national key performance indicator. In terms of deteriorating patients, or the acutely unwell, and observations, to improve the timeless of observations. What I mean by observations, the nurses say every 4 hours measure the blood pressure, pulse. They put the little thing on your finger to measure how pink you are, called your saturation, your respiratory rate, your temperature. So it's those basic physiological observations, and to improve the timeliness of those, and to also look in particular on a new area, a bundle for acute kidney injury, also known as acute renal failure. But that's all interlinked with sepsis and antibiotics, because actually it all tends to go part of that package when patients deteriorate. For medicines management, we wanted to make best use of patient group directions. These are the directions that we use, and we use quite a number of them in order to allow nurses to work in areas where we don't have sufficient prescribers. So we're not really talking about our normal wards, but we are talking areas such as acute oncology, where chemotherapy is delivered. We require nurses to give a lot of the supporting medicines, such as anti-sickness medicines, and our urgent treatment centres, as well as our sexual health services, do rely quite highly on those. Looking around the area of mental health, our responsiveness to children and young people with emotional well-being and mental health difficulties, improving the pathways in and around our CAMS, our child and adolescent mental health service, and reducing waiting times for access to specialist input and support, particularly in that service. Also looking at improving end-of-life care. So this was for the second year we were continuing that work. We looked to get feedback from bereaved relatives to improve the experience of bereaved relatives, in particular around our implementation of medical examiners, and ensure learning through systematic clinical team review of cases where patients have unfortunately died. And that's proven very handy to us during coronavirus. This is aligned to an end-of-life strategy work with commissioners. In terms of patient experience, we were looking at John's campaign for carers supporting those with dementia whilst they're an inpatient, and improving the assessment and management of pain for those with learning difficulties who present to the emergency department. In terms of staff experience, that's been a very important for us this year. We recognise the strong link between staff and patient experience, and we have our team who continue to develop systems of real-time reporting on staff experience, and I'm able to share with you that we've done extraordinarily well again in the National Staff Survey this year. So in terms of our performance, in terms of flow, we managed to maintain a bed occupancy of less than 92% in all quarters to date. That was, in fact, helped by coronavirus and the reduced attendances. And we also wanted to reduce the mean number of days between the patient being declared medically fit and the date they were actually discharged. And we have new processes in place for capturing this on a day-to-day basis. And ensuring that we have meetings to bring the gap between medical fitness and that discharge as close as possible. And we've also looked at the number of patients with a length of stay over 21 days, and we needed that to be less than 103 patients, and we've managed that in every quarter so far this year. So we did struggle with the management of acutely unwell patients in regard to the timeliness of observations. There was an awful lot of staff movement and a new system using our nerve centre and some improvement work. But because of the changes that we needed to make in terms of our nurse education team in and around the first wave of COVID, we had to discontinue that support. And unfortunately, we've managed to only maintain a position throughout the year of about 70%. And the two other metrics for this priority were delayed due to the impacts of COVID. So we didn't feel that we managed that, and we will roll that over into next year. In terms of the supply and administration of medicines, we have reduced our reliance on PGDs. In fact, we had very nearly 180 before the start of the year, so we actually reduced quite a lot going into next year, and we've reduced them further to 148, and there are further plans to reduce them still. So we are now no longer as reliant on patient group directives, and we're making more use of prescribers where prescribers are present. So in terms of CAMS and the children and young people's emotional well-being, we agreed to implement new patient pathways. We introduced an access team to manage referrals into our specialist services, and this has led to a positive impact upon patient access, and we feel we've met that standard. In terms of end-of-life care and bereavement, we wanted to make sure that the medical examiner team reviewed 95% of all deaths that weren't referred to the coroner. We had a rollout throughout the year across our sites with an increasing percentage of patients accessed by the medical examiners, and we achieved 96.9% of all referrals by Q4. So we concluded we met that target, and we now have a process that we built, that we have implemented for subspecialty review meetings of deaths, and those are going on in all of our medical specialties and in our surgical specialties where we have a significant number of deaths. And we've used that to review particularly and feedback quite quickly patients and learn from patients who were dying in the first wave of coronavirus. We had completed a trial for John's campaign in August 2020 in the gap between the first and the second wave. We had an information campaign that we disseminated trust-wide, and we had a patient experience visiting project that was undertaken to understand impact, and they will go and revisit that when they start again in April, having been stood down for the second and third waves. And also we undertook a focus group in December to understand the experience of patients with learning difficulties, and we formatted and designed a health card which was agreed which will be rolled out. That process has taken us a little longer than anticipated, so we haven't managed to complete that this year, but we will complete that in due course. In terms of staff experience, looking at the domain of joy at work, we found that all domains of staff experience were statistically better compared with baseline, and we're very proud that we were able to maintain staff experience through a difficult period of time. Health and wellbeing scored were captured on a regular basis, and we used an app for real-time feedback called Corona Voice, which we then renamed Northumbria Voice. And we've now shared the learning from that through a number of publications, and we used that to create quite a large number of avenues of staff support as staff went through the campaign. So every year, talking about the safety and quality priorities for 21-22. We've already had meetings with our business unit, our governors, and other stakeholders, and some other stakeholders to identify a number of safety and quality priorities, and we've identified 8 possible quality improvements for next year. Some of those build on previous improvement work, but what we really need to emphasise is that these are 8 measurable things that we undertake and commit to. This is not by any stretch of the imagination all the quality improvement work that will be done. There will be many other improvements which we undertake at a business unit level throughout next year, some of which we will include in our quality account. So the 8 priorities, we retain one on access standards. So that's in terms of flow, but as you know, we need to recover to get our waiting lists right back to where they were. It's something we're very proud of our performance through COVID. We're pretty much ahead of the game in the region and nationally in terms of mitigating the impact of coronavirus on our waiting lists. In terms of outpatients, there were quite a number of changes that occurred to the way that we run outpatients that occurred in the first wave. We've obviously started much more face-to-face, so that it's now people have a choice between virtual and face-to-face attendances. And when we talk about embedding these changes, what we're really aiming to do is to ensure that all outpatients, irrespective of how patients choose, to visit us, will have the same high standards of patient experience. In terms of deteriorating patient, we remain committed to improve the management of acutely unwell patients, both in hospital and community settings, and we're running a pilot with community providers in nursing homes. In terms of delirium, we are going to have a real focus on this year, building on what we learned from John's campaign, with improved detection of patients with delirium, and we'll be training staff to improve that early detection. We'll continue to improve our output in terms of patient group directives and reduce not only the number of PGDs, but also the number of patients who have medicines administration via PGDs. We'll also be carrying on with our improvement with child and adolescent mental health service, because we need to continue to recruit into that service and build on the work undertaken last year to consolidate the improved access. To ensure our patient experience gets back the experience of pre-COVID levels, hopefully with the reintroduction of better visiting than we were able to achieve during the second and third wave. In terms of staff experience, to build on the successful staff experience programme with the embedding of the real-time staff experience reporting that we found so useful during coronavirus. So I've got, I can see any hands, and I'm really very happy to take any questions. So I can see you all. I am going to stop presenting, but I can bring the slides up for you after I do that. Okay.
Thank you. Do I have questions? Can't see any either. No. Could I maybe just ask a quick question then, Jeremy? Thanks for the detailed presentation. In relation to priority around the CAM service, could I ask, has there been any notable increase in demand for that service due to COVID, or have we not seen the impact of that yet, would you say?
So I don't think we've seen an impact in that. And in fact, I have seen some both national and European data that actually suggests that whilst there has been a lot of people who have had happiness issues, shall we say, due to the pandemic, this hasn't actually translated into access to services of a specialist nature, such as CAM. So who knows whether that will be to come again next year. But they were continuing through the pandemic to see patients. They did have some difficulties, particularly with their clientele, with the use of video technology. It wasn't always appropriate, but we have tried to keep our options open for patients during that.
Thank you. Thanks, Jeremy. Do I have any other questions or comments from anyone? No, I can't see anything. I'd just like to say again, thank you. I know it's been an extremely challenging year for everyone. And I think, just thank you to everyone involved in, the services that have been delivered. And I think it's, just absolutely phenomenal that there's an ongoing commitment to continuous care, even amidst an international pandemic, not just a national pandemic. And it has been really difficult for everyone. So thank you for that, Jeremy. We'll look forward to receiving the quality account. And of course, we're asked to provide a statement on behalf of the committee in relation to that. So I think traditionally we've either had a subgroup set up to do that, or it's been left in the hands of the chair. Obviously, the quality account will get circulated to all members of the committee. Do we have anyone who has a favoured option? Do you want a subcommittee set up to look and prepare the statement for May, or are you happy to leave it in the hands of chair? Jeremy, did you have your hand up?
Well, you answer that question. I just wanted to say something.
Go on, then you can say it while we're thinking.
Well, I just, we've all lived through this pandemic. It's affected us as healthcare providers, but we all live and work, we live in this community. And I must say, I just wanted to thank the public because I think we've had a fantastic amount of cooperation in what has been unprecedented times. There's been a lot of talk about how much the rules are obeyed or broken, but actually we've had very, very little difficulty with the changes that we've made. Everyone has really pulled together and cooperated. So it's really thanks to the support we've had from the community that we've been able to get through this. So I just want to thank everyone for that.
Just to add to that, Jeremy, I think thanks to the local authority, we've had a fantastic working relationship with the executive and had great access to councillors too. So really big thanks.
Yeah, thanks. That's good to hear. Okay. Members of the committee, does anyone have a favoured position? Are you happy to leave this with the chair? Obviously, you'll get a copy of the account and we'll ask for any comments or feedback to be incorporated into the statement if that is the case. Can I propose that that is the case? See, no one seems to have a hand up.
I can agree to that.
Lovely, thanks, Joe. So we're taking that as a given then.
Yeah, I agree with that.
Yeah, I agree.
Fab. Thank you very much. And a big thanks again, Jeremy, to yourself and your team. And thanks, Claire. Okay. Thank you.
Okay. Well,
Thank
have a
you.
safe evening.
Thank you, everyone. Thanks. Thanks, Jeremy.
And a happy Easter.
Oh, yes. Forgot it was Easter. Yeah. Thank you.
All right.
And to you. Thank you.
Bye-bye.
Bye-bye. We'll move on to item 6 on tonight's agenda, which is the COVID-19 update from Adult Social Care. And I invite Scott Woodhouse to present this item, and Chris Woodcock is also in attendance to provide information in relation to public health. Again, members of the committee will have an opportunity to ask questions after the update. Thank you. Is Scott there?
I am. Chris is going to go first, I think, to lead with the public health presentation, and I'll follow on. Thank you.
Lovely. Okay.
Thank you, Chair. I'm just bringing up the presentation. Bear with me.
I've seen from social media quite a lot recently. People are asking why. So is my wonder.
Thank you also. Hopefully I'll just in a few slides give you a bit of an update on the current outbreak situation in relation to COVID-19 across North Tyneside. Excuse me. So as you can see there, some of the headline figures. Currently we have an infection rate per 100,000 of the population of 47.1, and in relation to confirmed cases, has been 98 confirmed cases in the last 7 days. They are pleasingly low figures, and obviously that gives us a lot of optimism moving forward in relation to how much progress that we've made through the recent lockdown and all the various measures that have been put in place, and gives us great optimism as we move forward the stages of the roadmap and begin to come out of the different stages of it. As you can see, the two charts below just kind of plot the rise and fall of infections across the borough in relation to many of the restrictions. And as I say, where we're at now is a very low, comparatively low figures, certainly ones that we've not seen this year. So that's really positive in relation to how the infection going, and kind of bears testament to how well adhered to the various measures have been across North Tyneside. That's just another way of looking at some of those figures. That's the 7-day infection rate by age group. This is of interest, just as we're all very aware, the pandemic doesn't affect people equally. So it's always useful for us to understand how it's transmitting throughout the community. Again, we can see a very positive decline on the whole throughout all those. It's very noticeable in the 65 plus age group. Which will be impacted by the vaccination programme, which has been very successfully rolled out across the borough currently. Also, at the other end of the age spectrum, we'll see the kind of the 0 to 14s that did rise when schools returned, but is kind of plateauing and isn't possibly at the level that some kind of authorities across the country potentially anticipate it might do. What we can kind of see there is the probably slightly stubborn figures of the 35 to 49-year-olds, which is probably very reflective of people who are at work and kind of who have to go to work and are unable or have been unable to work from home. So obviously that face-to-face interaction does present greater risk of transmission. So that's kind of remained slightly stubborn, but again, on the whole, it is showing a very pleasing decline. In relation to testing data, again, as we can see there's been a phenomenal number of tests conducted in the last 7 days. As you can appreciate from the graph there, testing has risen rapidly across the borough. The recent spike will have been in relation to schools returning, and I'm sure members are aware of the school testing regime that's in place. We obviously have community testing in place, care home testing in place, so many workplaces are now testing, and that is very likely to increase. So these sorts of testing figures are probably going to rise in the coming weeks and months as well. But Again, you can just see the quantity that have been processed, and that has resulted in kind of the 98 positive tests and a low percentage of those being positive. Again, as I'm sure we'll appreciate, the more people that we test, and as kind of the community transmission and infection levels start to go down, then the less positive we'll find. But also, this is the benefit of a wide-reaching testing program, because it allows us to identify those and act upon them accordingly to try and reduce the onward transmission. I know this has been shared previously, but this is just to highlight how it hasn't necessarily affected the borough equally. And we can see there that there are different levels of infection and different rates across the borough and in different wards. Again, it's a picture which is seen across the country, but I guess it just highlights how COVID hasn't been an equal impact across the area. So this just allows us to kind of pay greater attention in certain wards and boroughs where it may be required due to just nature of potentially occupations, as I've already touched on. So it just provides us with that extra granular level of detail to focus our efforts where required. Just for interest, we've currently got around about 24 ongoing outbreaks across the borough. Again, going back from kind of previous peaks, that is a low number. The team is actively managing those. They are predominantly seen across care homes, schools and workplaces. Again, comparatively, we have far less of them, and we are working with each of those kind of settings and institutions to help manage and control the onward transmission, ensure all the appropriate infection control measures are in place. So that's been a very successful element of the local authorities' response. And just in relation to schools, since they've returned in the last few weeks, albeit now that it's the Easter holidays again, the positive cases as of the last 17 days from the 27th of March is we've had 41 pupil absences and 6 staff absences. Again, that does generate quite a few pupil absences and staff absences in relation to their direct contacts and kind of schools' approaches to bubbling. So again, you can see there is still and will continue to be an impact of every kind of positive case within the school setting, but the benefit of the school's testing program is that it's allowing us to identify those quickly and kind of give that advice for people to isolate accordingly, which helps to control the onward transmission. So the sooner it's identified and the appropriate courses of action are put into place, the better. And just finally, for members, in relation to deaths, sadly there has been 462 since the beginning of the pandemic, but in the latest week, that's gone down to 6. So as we can see that, well, that's definitely a marked decline over kind of recent weeks and months. Hospital bed occupancy also continues to decrease for COVID positive patients across the trusts, again, which is very positive and reflective of both the kind of decline in community transmission and very probably the impact of the vaccination programme, which is helping to kind of reduce the severity of those infections. And that's all I wanted to say, Chair. Thank you. If I can pass you on to Scott.
Yeah, thanks very much, Chris. Scott?
Yeah, thank you very much. I'll just okay, so just an update for Scrutiny Committee. A reminder, I've showed this slide in the next slide, the last couple of presentations, but I think it's just useful to remind ourselves about the work that we're doing and I guess the strategic impact that we want to have from the involvement and the work with care providers and with services more generally, ensuring that services are delivering to support those vulnerable people and at the same time keeping people safe. Again, just the numbers, just a reminder of the context in relation to numbers of services, number of places and beds and services being delivered to individuals and those staff numbers in total. Chris shared on his slide, outbreak slide, some of the wider stuff. This is particularly around care homes. I'm pleased to say that we've got, I mean, this is out of date as at lunchtime today, unfortunately, in that one of the homes has come out of outbreak. So we've only got one home, older person's home, in an outbreak at this point in time. And when I presented to committee on the 11th of February, we had 10 in outbreak. So there's been a significant decline in the numbers in outbreak. And that's predominantly because we haven't got the numbers of either residents or staff that are getting tested and having positive COVID tests for staff and for residents. So that's all very positive, and some of that will be around sort of the impacts of the work that we've done, infection control, the work with care home providers to manage the outbreak situation, but also through the vaccination programme and a number of things. So it's down to a number of measures that are coming together to show that overall impact. And as I say, the numbers are really low, and overall, and we will continue to monitor and keep an eye on that. But it's a massive difference to where we were just 6 weeks ago. In relation to those providers themselves, slight change in the numbers of vacant beds. A bit more slightly worrying in that the last slide deck had 302 vacancies. It's now up to 325. So there's an increase in the number of vacant beds. So occupancy has decreased. Again, that's just putting added pressure on the market and on care homes because of sustainability and how long they can maintain those numbers. Without having an impact on their abilities to deliver. In the bottom left-hand corner, there's the step-down beds at Hadrian. They come to an end today in line with the contract that we had in place through the CCG for those step-down beds. And as you can see from the numbers, whilst we had 18 beds commissioned, we never actually needed that number. The highest that we got to was about 12, and certainly in the last number of weeks, we've been down into low single figures and no people in those beds for some time. And again, that's down to overall low numbers of people, with COVID coming out of hospital, and the turnover of or the abilities for people to go back to care homes directly without going through the designated beds at Hadrian House has seen that reduction. Just touching on vaccinations, so by the end of this week, in fact by tomorrow I think it is, all older persons, care homes, staff and residents will have been offered a second vaccination. So we've had a programme in place for the last 2 to 3 weeks of going around all the care homes for the second time to give second vaccinations for staff and residents, and at the same time have had a programme in place over the last 10 weeks or so, picking up mop-up exercises with staff and residents that were missed the first time round for a variety of reasons. So overall, we're seeing really good take up of those vaccinations across the care home sector and across the wider sector as a whole. But there's still some work that we're doing with the care providers, primarily with care homes, around staff hesitancy and a number of situations for a variety of reasons why staff aren't willing to have the vaccination. There's a number of measures that were put in place with those care homes and with managers and offers of support to those people to persuade them to get that vaccination. For working age adult homes, that's the sort of learning disability, mental health, physical disability homes. They're due their second round of vaccinations towards the end of April, and that's because the cycle of doing them for the first vaccinations was a few weeks behind the older persons care homes. So by the end of April, all care homes in the borough will have been offered second vaccinations for staff and residents. So again, a really good place to be. And then within the GSAVI sort of vaccination cohort, there was one of the priority groups was around frontline health and social care workers. So that was priority group 2 on that GSAVI list. And this includes a range of staff, both internal to the council and external to the council, so through commission providers, home care, extra care, supported living, day services, etc., as well as internal staff. And what we did was we did some work with the regional ADAS, which is the Directors of Adult Social Services, and the Directors of Children's Services to agree a priority ranking of staff groups. And we've got them listed there from 1 to 5 at the bottom, which just sets out the priority for getting those staff done. So primarily, priority 1 was those people who were working with older people on a routine basis, where they were up close and delivering personal care to those individuals. As you can see from that, we've got a really high percentage of staff vaccinated in that group. And then as you work down, it's still people who are working with vulnerable adults and children, but in lesser up close and personal settings or situations, but still with the risk of infection and cross-contamination across a number of other people that they might support and work alongside. So overall, really good numbers there from the point of view of those vaccinated, low levels of declines, and still some people that we need to get through in some of those more external settings that we've got. And that just gives an overall number of those people. So sort of 5,500, nearly 6,000 staff involved in internal and external. And then we've split that down between adult social care staff. And this is both internal and external, sort of adult social care, children's services, non-HEX staff, so some staff across the wider council that fell within those groups of supporting vulnerable adults. And then the final one is around provider staff, so the external staff that we've got delivering services out there. And just a couple of updates in relation to care homes, visitors and visiting professionals. So visiting professionals, so this is primarily around NHS staff that go into care homes to deliver services, to do things. So GPs, it might be district nursing, it might be ambulance services, etc. And there was a recognition that care homes are doing an awful lot to maintain the integrity of the care home and not allow people in unless it's absolutely necessary. And when we start to get into a position of things getting a lot better and thinking about all the work that's gone in within care homes around getting staff tested on a regular basis and getting staff vaccinated, etc. Again, I think there was some nervousness about other people coming into the care homes and potentially creating some additional risks there. So some guidance came out around that, and basically that any visiting professional should have proof of a negative test in the last 72 hours, and be able to prove that and show that to the care home manager to allow entry to the care home. Equally, we've pushed this out to sort of internal staff, local authority staff that might go into care homes. So the staff in my team that go out and do monitoring visits or do assurance checks, they fall into that group, and they are routinely tested, and potentially might have a situation where some social work staff might start to be going back into care homes to do assessments and reviews of if there's safeguarding issues, just making sure that we've got eyes on in relation to some of those issues. So it's an ongoing dialogue that we're having with care homes and wider NHS staff. But just want to make ensure that you're cited on that from that wider work. And then in relation to visitors, family members, etc., there's new guidance came out that supported inside visiting, obviously, except when a care home is in an outbreak situation. As I said earlier, we've only got one in that situation at the moment, as opposed to 6-7 weeks ago. That guidance came into effect in March, early March. There's a single named person identified, and it's that single named person who has the abilities to go into the care home and visit the relative, the loved one. There is testing, there is still use of PPE, social distance and hygiene measures, etc., that are in place to maintain that integrity within the care home itself. As I said, visiting suspended when there's an outbreak, except when it's sort of last stages of life for the individual. But equally, outside visiting can still occur for others, and subject to I guess, overall, the discretion of the care home manager and the capacity of the home to manage this additional function and this additional task for support and visiting. I think I've got to say across the board, the homes have welcomed this and have supported this and are working collaboratively and collectively to ensure that it does happen and supporting this across all of the homes. And I think whilst there still will be some instances where there's some issues, particularly around some family dynamics where we're trying to get the home's trying to get to grips as to who the named person is. But overall, we're getting very little in the way of complaints or in the way of issues being raised on this, either through members or through the Mayor's office, or equally through conversations that we're having directly with care homes themselves. Thank you very much, Chair. That covers the presentation. If there's any questions for myself or Chris, more than happy to take them.
Great. Thank you very much, Chris as well, and Scott. Very detailed presentations, and it's great to get those updates. Fabulous to hear that the rates are falling, and that we can have some degree of optimism going forward. Fingers crossed. Okay, do I have any questions, any comments from the committee? No, don't seem to have any hands up. Well, I'd just like to say a huge thank you to you both.
No problem.
And we look forward to hearing more, and hopefully the figures continue to go in the right direction. And we know it's thanks to the hard work of a lot of people. And obviously, the vaccination program's been phenomenal. I'm based in the Oxford Centre in Long Benton, and it's just been absolutely tremendous, I have to say, in there. It's been a wonderful thing to see. And it's great to see that the decline rate is so low as well in the care homes, because that was a concern for me. And obviously we've still got to continue to try and encourage people to take up the offer of the vaccine.
Yeah, Chair, I'll just come in there. I think if you compare where we were this time last year, March, April, May, and the numbers and the impacts of those numbers, I mean, it was horrific. And if we could foresee what was going to come and the coming out the other end to some degree with some of the numbers that we're seeing now, it's a really good place to be in. But clearly there's been a lot of challenges on the way and lots of impacts and for individuals and for family members and for providers themselves. But absolutely, it's a much better place to be in.
Thank you, Scott. Can I bring in Councillor Trish Breen?
Thank you, Chair. Thank you for that. As Karen said, I think we're all very appreciative of the work that's been done and the figures moving in the right direction. I just wanted to ask, because I asked this the last time in relation to care home staff who are still slightly wary about the vaccine. I know there's been quite a lot of work done there. Is that number diminishing now, the people who've got concerns about taking the vaccine?
It's coming down. It's not where we'd like it to be. I think, if we're honest, I think we've done a lot of work with the care home managers. We've put webinars on. We've got stuff on YouTube with various people on a panel talking about and responding to questions that are being raised through care homes. We, myself, Chris, and Ellie Anderson from Adult Social Care have had a number of conversations, one-to-one conversations with care home managers to understand the issue in their particular home, and to support and offer solutions and additional support that we can bring to it, whether it's through the local authority or through the NHS, through GP practices, etc. To reduce that number. That's ongoing, so we are seeing a decline, but I think there's still work to continue to do. And I think overall, we want to get it to a position where it's 100% covered. I think there's a number of issues, whether it be health related for individuals, and I think we need to consider that and take that into account. Absolutely, some of it is in relation to cultural issues by different staff groups from different ethnic backgrounds, and again, we're reaching out to Voda and their workers who are supporting on that and having conversations with a particular care home that I've got in mind, talking to their staff that are raising issues around their particular concerns. So I think it's continuing with those conversations and continuing that push with those providers to reduce that right down.
Okay. Thanks very much, Scott. Thank you.
Okay, thank you for that. I don't see any other hands up there, Scott, so I'll just say thank you and thanks very much for all your hard work. Lovely, thank you. That actually concludes our business for tonight, everyone. So it just leaves me to say thank you very much for your attendance. Happy Easter, everybody, and happy electioneering. Good luck with all of that, and we'll look forward to seeing you all in the new municipal year. Happy Easter.